High-key stressed, low-key depressed. Obsessive-compulsive disorder, also known as OCD, is an anxiety disorder in which a person has repetitive thoughts, feelings, ideas, and sensations, or behaviors that make them feel driven to do something. Often the person carries out the behaviors to get rid of the obsessive thoughts, but it only provides temporary relief. Not performing the obsessive rituals can cause grave anxiety. A person's level of OCD can be anywhere from mild to severe. But if severe and left untreated, it can destroy a person's capacity to function at work, at school, or even lead a comfortable existence at home. OCD affects about 2.2 million Americans, and the problem can be accompanied by eating disorders, other anxiety disorders, or depression. Although OCD symptoms typically begin during teen years or early adulthood, research shows that children may develop the illness during preschool. Some research indicates that OCD might run in families. OCD obsessions are repeated, persistent, and unwanted urges or images that can cause distress or anxiety. You might try and get rid of them by completing a compulsion or ritual. These obsessions typically intrude when you are trying to think or do other things. Obsessions often have themes to them such as fear of contamination or dirt, having things orderly and symmetrical, aggressive or horrific thoughts about harming yourself or others. Examples of obsession signs and symptoms include fear of being contaminated by shaking hands or touching objects that other people have touched, doubts that you've locked the door or turned off the stove, intense stress when objects are not orderly or facing a certain way, images of hurting yourself or someone else, thoughts about shouting obscenities or acting inappropriately, avoidance of situations that can trigger obsessions. Compulsions are a response to obsessions, a way to deal with or neutralize them. Compulsions can be things other people can see, or they might be mental actions, such as ritualized praying to try to counteract thoughts the person feels frightened by. As with obsessions, compulsions typically have themes such as washing and cleaning, counting, checking, demanding reassurances, following a strict routine, and orderliness. Examples of compulsion signs and symptoms are hand washing until your skin becomes painful, checking doors repeatedly to make sure that they are locked, checking the stove repeatedly to make sure that it's off, counting in certain patterns, silently repeating a prayer, word, or phrase, arranging your canned goods to face the same way. Symptoms usually begin gradually and tend to vary in severity throughout your life. Symptoms generally worsen when you are experiencing more stress. OCD is considered a lifelong disorder and can be so severe and time-consuming that it becomes disabling. About 7 out of 10 people with OCD will benefit from medications or exposure and response prevention. The exposure in ERP refers to exposing yourself to the thoughts, images, objects, and situations that make you anxious and or start your obsessions. While the response prevention part of ERP refers to making a choice not to do a compulsion behavior once an anxiety or obsession has been triggered. I'm not going to be able to get that now. So. All of this is done under guidance of a therapist at the beginning, though you will eventually learn to do your own ERP exercises to manage your symptoms. The types of medication that research has shown is the most effective for OCD are a type of drug called serotonin reuptake inhibitor, which are traditionally used as an antidepressant but also helps with OCD symptoms. For people who benefit from taking medication, they usually see their OCD symptoms decrease by 40 to 60%. The following antidepressants have been found to work well for OCD in research studies. For medications to work, they must be taken regularly and as directed by their doctor. People with OCD often spend less time participating in social activities because they might try to avoid contamination. Fears of being contaminated by others, for example, may prevent them from participating in contact sports. They fear that participating in extracurricular activities will cut into the time they believe is needed for their rituals. They may be physically and mentally exhausted by their obsessions and compulsions and are just simply too fatigued to be able to participate in social activities. They know their OCD rituals may seem weird to others and sometimes prefer to keep away from peers than to risk social rejection, humiliation, and even bullying. During their school years, children typically build social competencies such as making and keeping friends and selecting friends based on shared interests and compatibility. In many cases, they are struggling not only with OCD but also with coexisting conditions, which may affect their proficiency with social skills. They may have difficulties with recognizing how others feel, expressing their own feelings, and choosing appropriate language to express themselves, figuring out how others will act to what they do, being flexible and reacting appropriately to situational changes. When you're living with or close to someone with OCD, here are some rules you probably should follow. Recognize signals. Modify expectations. Remember that people get better at different rates. Avoid day-to-day comparisons. Recognize small improvements. Create a supportive environment. Set limits, but be sensitive to mood. Support taking medication as prescribed. And try and keep the family routine as normal as you can. It can be difficult, demanding, and exhausting to live with a person who has OCD. The best thing a family member or friend can do for someone suffering from OCD is to encourage and help the person to seek treatment. If you have OCD and need help, you can go to a therapist, a clinic, or a support group. Some celebrities with OCD are Howie Mandel, Justin Timberlake, Cameron Diaz, David Beckham, Leonardo DiCaprio, and Howard Stern.